It's 12 minutes past 7. It's Monday morning, and every day thousands of doctors, nurses and healthcare workers are putting themselves at risk to treat those infected with COVID-19.
And the blunt reality of the danger has been illustrated by the tragic loss of several NHS staff. Tom Solomon has been working on the front line at a hospital in Liverpool, filmed this for us, and this insight into his day for us.
Good morning, my name is Professor Tom Solomon. I'm the Director of the UK's Emerging Infections Research Unit.
My exercise for the day, I suspect Peggy will get more walks because everyone in the house needs a reason to get out.
So I've been involved in the coronavirus outbreak right from the start really, in January. Most days have a mixture of looking after patients and then also supporting the research effort. But every day is different, especially as things change so rapidly. The day tends to be pretty unpredictable and pretty tiring.
I'm going to head on into work now. I'm not allowed to film inside the hospital, and to be frank, I've got better things to be doing inside there anyway, so I'll catch up with you a bit later on. Well, I've finished working in the hospital for now. What can I say? It's busy. It's getting busier. It's quite sad. The staff are working brilliantly to look after patients, and working very well together. I'm here in the Ronald Ross building of the University of Liverpool, which is where much of our coronavirus research is happening. So our labs are full of people who are studying samples from patients up and down the country. We're leading from Liverpool a national study, and we have more than 5,000 patients so far. And these samples are being used to improve the diagnosis of the disease and to understand why some people die and some people live. The results will help us with development of vaccines and also development of new treatments. Sorry to interrupt you. Tell me what you're working on at the moment.
Recently, I'm trying to purify the spike protein from COVID-19.
It's really important to work on this at the moment, and it's a really exciting area of research, especially as the field is advancing so quickly.
That's the end of the working day, and in theory, until I get home and again see what's happened even in the last half an hour. I think one of the things that's maybe hard to convey on a video like this is how rapid everything changes and how flexible you have to be. You just think you know what you're doing for the next hour or two, and then suddenly everything changes. Maybe there's some government advice, maybe something's changed in the hospital, maybe people you thought were coming to work aren't coming to work because they're self-isolating, maybe family or friends, somebody's been in touch, they're anxious about something. And what all that means is that it's a little bit more stressful than normal, and you have to be able to respond quickly and keep calm despite whatever's going on. Because my clothes may be contaminated from work, I get changed in the shed before I go into the house. The official working day's finished now, finished in the hospital, finished in the lab, and now I have to face all the emails that I've not dealt with during the day. And I've got a conference call with colleagues in America tonight. We're beginning to see patients with neurological disease caused by COVID virus, and we want to study these together to try and understand what's going on. So the day, tiring as always. It's a privilege to work with some of the fantastic healthcare staff in the hospital, some really great people who are working so hard to try and look after so many patients. And I guess on a personal level, today it has finally hit home. I've been saying to people for weeks, we're all going to know somebody who's died from this disease, and very sadly I heard just on the way home that a lovely woman who I've known since I was age 8 when she first taught me, and who's been a family friend since then, has died in hospital today. But this is what we're all going to face over the next few weeks. We're all going to know people who've died. It's going to be terribly sad. But we've also got a job of work to do to look after the patients who are coming to our hospitals.
and doing the research so that we can develop better diagnostics, treatments for the patients, and ultimately vaccines to keep this horrible disease away in the future.
Well, many thanks to Professor Tom Solomon, who did that for us and now joins us from Liverpool. Thank you so much for joining us, and I'm really sorry to hear about your family friend. And you make that point that all the time this gets closer to all of us in some ways, doesn't it?
Yes, it does, and unfortunately, I think many of us are going to find ourselves in this situation. Yesterday, we also heard that one of the nurses at one of the Liverpool University hospitals has died as well. So this is becoming, very close and personal, I think, for all of us across the country.
Yeah, and thank you again on behalf of all of us for the incredible work that all of you are doing, and as you say, kind of really putting your lives on the line. Can I just ask you a few thoughts about, for example, we know that Boris Johnson went into hospital last night. We know it's precautionary, and it's about 10 days since he was first diagnosed. So what can you tell us about, the prognosis of where he might be?
I can tell you nothing about Boris Johnson's prognosis because I'm not his doctor, but I can tell you in general that we do see patients who get worse around this period, and after they've had the initial fever illness, then some of them do deteriorate a little bit, and it may be something just as simple as a chest x-ray was all that he needed, or it may be a little bit more serious. But like I said, I don't know anything about his personal case.
Yeah, of course you don't. Just tell me a little bit about, so, somebody goes in with 10 days. What are you talking about, those kinds of tests? Those tests need to be made in hospital, do they?
Yeah, the only place you can get a chest x-ray is in a hospital or a clinic. And then in addition, sometimes scans are done, more detailed scans of the chest. And what's sometimes happening with some patients with coronavirus is they're getting a little bit of fluid inside the lungs, which can make them feel a bit worse.
You do both sides of things. You work with patients. You also work on research as well. I mean, There's so insightful what you were talking about. You talk about being, really tough on the front line at the moment and really sad.
Yes, it is sad on the front line. Although actually, when you're working in the hospitals, you tend to just focus on thinking about the patients and what you can do to help make them better. It's really only afterwards, when you come out of the hospital, that you think a little bit about how difficult it's been. But the other very positive thing has been not only the healthcare worker response, but the researchers' response. So at Liverpool, for example, the university and the School of Tropical Medicine have joined together on a massive research initiative. And in addition to the more than £10 million of funding that we've had externally, we've raised 1.1 million from across the city region, and we're continuing to receive donations for further research, and that's allowed us to really expand the work that we're doing. So there's a very positive atmosphere in terms of all of the universities and the hospitals coming together to tackle this problem.
You talked about trying to find out why it is some people react differently to coronavirus. What is the most important thing for you that you want to find out?
Well, in terms of the research, we know that many people will have a very mild infection and won't come to hospital at all. Others will be sick enough to come to hospital and then will deteriorate. And one of the big projects we're doing, I think I mentioned it in the film, it's been set up by colleagues. It's a fantastic, quick response to this outbreak to set up a study across every hospital in the UK so that we can recruit patients. And by recruiting them, we're able to understand who it is that gets sick and needs hospitalisation, why they get sick, whether it's problems in the chest and lungs, whether it's problems elsewhere, and then what we can do to reverse these problems. And that's really where treatment comes in. And we're part of several treatment trials that are going on across the country to work out the best treatment. The vaccine's not going to come for at least a year, but there's been such a focus on understanding the body's response to the infection and developing treatments that I'm hopeful that we will have some treatments within certainly sooner than a year, perhaps within a few months.
And this is moving at a pace which presumably is really unusual.
In terms of the research response, yes. I mean, we've learnt in recent years that emerging infections are increasingly a part of what we're going to have to face. We responded to the Ebola outbreak and then to the Zika epidemic. In Liverpool, the Health Protection Research Unit in Emerging and Zoonotic Infections coalesces a lot of the UK research response and supports response against those infections. But I think every time we've got quicker off the mark, we've got quicker to
pull researchers together. And this time we've got an unprecedented national and international response to fight this infection. And we will defeat it. Although there'll be many sad stories along the way, we will get over this infection. Eventually the number of cases will reduce, either because the virus has spread through so much of the population or because we've developed other ways of controlling it, and we will beat it. And we'll have learned a lot more about how we can respond even more quickly for future outbreaks like this.
Well, listen, thank you for ending that on such an optimistic note as well. It's really good to hear. Professor Tom Solomon, thanks for your time, and thanks for doing that film as well. Thank you.
You're welcome.
Yeah, fascinating insight into the sort of day of one medic on the front line, and it's brilliant to speak to experts at times like this, isn't it?
22 minutes past 7.